Let me turn to Senator Harkin.
Thank you very much, Mr. Chairman. First, I want to salute our committee chair, Senator Kennedy, for his tireless and relentless and courageous leadership across many, many years in advocating for a comprehensive health reform for America. We are going to get it done this year. I also want to compliment and thank Senator Dodd for stepping in to provide his great leadership and his commitment to getting a progressive and affordable and quality comprehensive health reform bill accomplished this session. We all know what the goals are: affordable and high-quality health care, reduce costs for families and government and businesses, and protect people's choice of doctors and hospital and insurance plans. But there is one goal, I believe, that is overarching over everything. And it's the goal that I really believe enjoys strong bipartisan support on this committee, strong bipartisan support in the Senate and the House, and is supported by the great majority of American people. And that goal is to recreate America as a genuine wellness society, one that emphasizes wellness and fitness and good nutrition and disease prevention. In other words, the goal of keeping people out of the hospital in the first place. And I was glad to hear, Senator Enzi, you just talk about that in your remarks. I believe this is central to what we're doing. I've said many times, you can jiggle the system all you want. You can figure out how to pay and who to cover and what kind of plans, and you can get all that out there. But if we don't shift the kind of money we're putting into health care up front to prevent illness and disease, I don't care what kind of system you come up with, we're still going down. Because we'll just still be spending more money on patching and fixing and mending, pills and surgery and hospitalization and disability, rather than putting money up front, keeping people healthy in the first place. Now, we all know the statistics. We spend a staggering $2.3 trillion on health care, more per capita than any other country. Yet the World Health Organization ranks us only 37th of 191 member nations. We're on a par with Serbia. We spend twice as much money as Europe on health care, but we're twice as sick with chronic diseases and chronic illness. Now, we also have to make sure we improve the quality of our coverage. I mentioned that. And information technology. In other words, quit reimbursing for quantity and start reimbursing for quality. And Senator Mikulski has led that effort, and I compliment her for putting together a great title to this bill on quality. We have to strengthen our health care workforce so that we'll have the doctors, nurse practitioners, physicians, assistants, pharmacists, oral health, mental health providers, public health professionals, integrative health practitioners to provide care on the whole spectrum. And Senator Murray has led our effort in that and has put together a great title covering the need for our workforce in the future. And again, a lot of that workforce has got to be in the area of prevention and wellness and keeping people healthy. We have to take a look at our medical schools. I just spoke yesterday to a group of young people going through medical school, and were they taking courses on prevention? Well, they don't have that. They may get a lecture on it once during medical school. Are there any residencies in prevention? You can get residencies in everything except that. So we have to look at how, and most of this is tax dollars through the Medicare system, through graduate medical education. We should be emphasizing that doctors can, and other health professionals, I don't mean just MDs, but other health professionals, get training in prevention and wellness. As I've said many times, the truth is we don't have a health care system. Now we have a sick care system. If you get sick, you get care, one way or the other. But there's precious little to keep you healthy in the first place. Statistics are that about 95 cents of every dollar we spend on health care goes for pills and surgery and hospitalization and disability and everything. 5 cents or less goes for prevention and preventing chronic diseases. So we have a huge opportunity here to really make a profound change. And this is not just in the clinics. Yes, there's a clinical basis, and when we get to our title on prevention, there's a clinical basis for this. Well, for example, right now, Medicare will reimburse for nutrition counseling once you have diabetes. Yes. But if you're pre-diabetic, they won't provide for nutrition counseling, so you don't get diabetes. Now tell me how much sense that makes. Medicare will pay for one colonoscopy when you go on Medicare. They won't pay for any others. Now that doesn't make any sense either. So there is the clinical basis for prevention, but there's also the basis in our schools, in our workplaces, and I say to my friend Senator Enzi that we've met many times with Steve Byrd, and quite frankly, I believe what we have in here corresponds quite well. And not all of it's in here. Some of it's in the Finance Committee bill, because there's tax credits and things for businesses to provide those kinds of incentives to their people. So it's not all in our bill. Some of that's also in the Finance Committee. So it's clinical, it's schools, it's workplace, and it's communities. The Trust for America's Health did a great study. They came out with it last year, showing that small investments in community wellness programs had an immediate payback in the first and second years afterward. You didn't have to wait 10 or 20 years. They had immediate paybacks. And so we have to think about the whole spectrum, from early childhood, through schools, through workplaces, through communities and clinical basis settings for prevention and wellness. And while I say that, I might also mention that we can't forget about two other aspects of this. One is oral health care and making sure that our kids have good preventative health care in terms of oral health. We all remember the story, Barbara, that young boy in your state that because he didn't get oral care, got an infection and died from it, simply for the lack of preventative care for a young boy on oral health care. And then the other great one is mental health. We have to integrate mental health care in all these aspects. You can talk to any doctor, and I don't want to be accused of practicing medicine without a license, but you can talk to any doctor, health professionals. They'll tell you that many of the physical ailments that people have their genesis in mental health problems. And many times it occurs in children and in young kids. And so we have to not think about mental health as something we do after someone is really sick, but as something we do in the beginning, when first signs are showing up, when we can get to young kids in schools and places like that to get them through some difficult times with mental health assistance. And that could do a lot towards preventing later physical ailments. Well, Mr. Chairman, we have a great opportunity here. We have a great opportunity to not only provide the affordable care, coverage, everything, but we have an opportunity here to really redirect health in America, to make us a true health society, not a sick care, but a health care society. And that's why I sort of laid down a marker some time ago. I said, if we pass a health reform bill that extends coverage, but does nothing to reform our broken system by emphasizing prevention and public health, then we will have failed the American people, and we can't fail. Mr. Chairman, I know there are a lot of amendments to the Prevention and Public Health title of the bill, Title III. I found out last night 171 amendments to be exact, and I thought we had done a good job of working. Our staffs had working with the Republican side of this to try to get to some agreement. I thought we had a few, but now we have 171 amendments. We'll be working our way through those amendments. But I just want to reiterate my continued commitment, Mr. Chairman, to support the strongest possible bill that we can get in prevention and wellness and public health. So the lens that I will apply to every amendment is whether they will accomplish the goal of putting prevention and public health at the forefront, not as a tag-along, but as the forefront of our health reform efforts. So in the days ahead, I look forward to working with you, Mr. Chairman, and our colleagues on both sides of the aisle to make this title even stronger. Thank you, Mr. Chairman.
Thank you, Senator Harkin, very much.